Hey everyone, Tasneem here, and today we are going to be talking about how to set revenue goals, plan for profit, and make decisions about your rates based on data and not drama. Now, all of this is going to be with a spreadsheet that I actually created for my private practice growth academy members, but I'm going to be walking you through it so that you can create this on your own. But I will also be offering this for download, so do stay till the end for more information on that if you don't want to create this on your own and just want to hit the ground running. But before I continue, if you like this kind of content, don't forget to like, subscribe, and hit the bell notifications if you want to be notified when I post new videos. Now, before I share my screen, let me just give you some context into this video. I recently interviewed Dion Burrs from ProfMed and EasyMed as a guest expert on this channel, and we spoke about setting rates in private practice. Now, if you haven't watched it yet, go check it out after this video. It's super informative. But in the interview, we spoke about the importance of value-based pricing and also taking into account the cost of providing the service in order for you to charge realistically. So even though this spreadsheet is actually part of my academy, I thought I'd show you how you can create this worksheet yourself, the spreadsheet yourself. So I'm going to be sharing my screen with you real quick and talk you through it. So let me just bring up my screen real quick.
So what we have here is a normal Google Sheets spreadsheet, but you can also use the desktop version of Microsoft Excel to create this worksheet in. And essentially what it is it consists of three parts. The first part is where you are going to list all your business expenses. So this is where you're going to work out exactly how much revenue you actually need to make in order to cover your basic business expenses. The second section is how will you make it. So this is where you're going to list out all your revenue streams or how it is that you are actually bringing money into your practice in order to cover your business expenses and create profit. And the third section is what is the difference, which is where you're going to calculate whether your business is making a profit, is potentially going to make a profit or a loss, or whether you are going to break even. So we're going to use this tool to calculate what you can expect from your revenue at your maximum capacity, and then also how you can then plan for profit so that you are and ensure that you are able to pay yourself. Now, this is an important aspect that I want to cover. A lot of practice owners, they are operating from day to day, just covering the expenses, and at the end of the day they find themselves working so hard in their practice but they don't have any money to take home. And so what a lot of practice owners are doing is they're living hand to mouth from their practice, or they are using their or they are covering their personal expenses straight from their practice. So every time there's a little bit of money left over in their practice, they are using it for their personal use. This is really not a healthy way for you to run your business. You really need to you really need to aim to be able to pay yourself a set monthly salary, whether you are a sole proprietor or an partnership, but we will get a bit more into that later. So what you're going to do in your Excel sheet or in your Google Sheet spreadsheet is you're going to create two columns. Now, I will say the personal expenses column is completely optional. The reason why I added this in for my private practice growth academy members is just as an optional way that if you are not sure what it is that you want to be able to pay yourself, or what it is that you need to be able to cover in your personal life through the work you do in your practice, then you can use this column. But if you just want to set yourself a set salary based on your previous job or what you can expect to earn in the government sector, or you already have a personal budget and you know what you want to be earning, because everybody's situation is going to be different. Some people have dual income homes, some people have children, different responsibilities and budgets. So if you are not sure, you can create a column where you're going to list out all your personal expenses. So instead of saying salary here, you maybe want to say bond, and then you want to say school fees, And then you want to say groceries or whatever that may be, whatever those expenses may be, and you're actually going to list out your amounts here. So, and allocate an amount here. Okay. And what you want to do is then add up everything in that column to come up with your total monthly and total yearly expenses. Okay, so I'm not going to list a whole bunch of expenses here now. For the demonstration purposes, I'm just going to say salary. So let's say you are an entry-level therapist in a government school, and you're earning a teacher's salary, and roughly what you come home with is 20,000 Rand, and that's what you want to expect to pay in your private pediatric practice. So as you can see that whatever amount you put in there, this column is added up and comes up with your total monthly expenses, which in this case is your salary. What you want to do next is create a second column, which is for your business expenses. And you're going to do the exact same thing as was done in the personal expenses, where you can list out. Now, just be aware the figures that I've put in here are just dummy numbers, made up things, random things that generally tend to be expenses and practices. But of course, everybody's practice and situation is going to be different. So this is just to give you an idea for demonstration purposes, how you need to set up your worksheet and how it needs to work. So what you will notice here is that in the very first thing that I want you to put in this column is actually your owner's salary. So the reason why I want you to do this is because you need to plan for what it is that you want to be able to pay yourself, because you as a salary, that is one of your expenses. Now, this is not to say that you're just going to pay yourself first and not pay your suppliers or your whoever you need to pay. It's just, this is a planning tool. So the idea of this is so that you can plan to be able to pay yourself plus all your expenses. So what I want you to do is in this column, in the amount column, you are going to actually, if you use the personal expenses column, you are actually going to draw this figure from the total personal expenses. So you're going to create a formula over here that adds up all your expenses, and then this amount you are going to pull into your owner's salary. So if you have a look at, if I had to change this now to 25,000, it will automatically change over here. Now, of course, if you are not going to use the personal expenses column, then you don't have to use this formula. You can just simply put in the amount that you want to put in. Okay. Then you're going to list out all your business expenses that you have on a monthly basis and put the amounts there. Now, I want to draw your attention to some of the expenses which might be annual expenses. So, for example, if you think about your Health Professions Council registration fee, which is an annual fee, or maybe you belong to your professional association like COTASA or SASP or SASHLA or whatever it is that you belong to, and perhaps the subscription fee is annual. So even though those are annual, you want to actually divide that by 12 and calculate the average annual monthly expense that you need to account for. Now, there's two benefits of this. One is that you can then easily account for that expense on a monthly basis and spread that cost across the year. But the second benefit of that is that you actually do then plan for that cost. I know most people will relate to this, but it's really tough that when you have to pay your HPCSA fees and OTASA fees and all these fees, and they all kind of come due at the same time just after you've come back from, the festive season, you've spent all your money. So this is also a good way that if you are actually budgeting for it in your monthly expenses by dividing that cost across the 12 months, you can actually then take that amount and put it away and in a savings account, so that when that amounts come due, you are able to pay for it. Now, here's the other thing. Even though profit is not a business expense, nor are savings, I actually want you to put that in this column. And the reason why you're going to do that is because this is you planning for profit. So by allocating your profit as an expense, this is how you are actually going to plan and make sure that you actually account for that in calculating how much revenue you need to earn in order to make that amount of profit. And then savings is separate to profit, because if, for example, in your field there is a specific piece of equipment or a particular assessment which is really expensive and you can't really afford to buy it out of pocket, then this is a good way of planning for that and saying, okay, well, the assessment costs X amount and I would like to be able to buy it in the next 6 months. So if I put away about 500 Rand every month, then I should be able to purchase it within that time frame in the business expenses. Now, the other thing that I want to draw your attention to is that you want to be cognizant of the fact of whether you are a sole proprietor or an Inc. So there's some key differences you need to understand about the two when it comes to allocating owner's salary. If you're a sole proprietor, you technically aren't paying yourself a salary because all the revenue that you earn in your business is yours because you are the business. And as a sole proprietor, you would be taxed on the revenue that you make in your business. So whereas as an Inc., you're paying yourself a salary, you actually pay yourself a salary as an employee in your business, and that is a tax deductible expense. So even though you are a sole proprietor and you are putting in owner's salary, it actually is a form of drawings. So you would still get taxed on the full amount of profit or money that you bring into your business, or revenue being in your business, including whatever it is that you pay yourself. It's not taxed separately. On the other hand, if you are an Inc., you would actually have to pay tax on your behalf from your business, or you can pay yourself the full salary, and then you as an individual will then be responsible for paying your tax to SARS. So either way, tax will have to either be paid by the business on the profit that it has generated, or it will have to be and the individuals and you as an owner has to pay your own separate tax, or as a sole proprietor, you will pay one tax amount on the full revenue that you are earning in your practice. Now, this, I'm not, I will say full disclaimer, I'm not a financial or accounting expert. So if you do want to find a bit more information on that from the expert, I do have a guest expert from Inora Accounting, Ryan Goldberg, who breaks down the differences in the tax structures of the different business entities in detail. So that video card should appear on your screen in the top corner or in the show notes below. So to continue, what's going to happen then is that you need to create a formula that calculates, where it pulls in all of these amounts and calculates your total business expenses. Then what you want to do is create a section that calculates what your total expenses, including your savings, are and for the month. So this figure is just pulled in from this figure over here. And then your expenses, of course, is your total expenses per month multiplied by 12. Okay, now that is your expenses and savings, but not necessarily the total you want to make. The next section you want to do is based on your total expenses per month and your total expenses per year, what is the total you need to be making per month? Now, what does this mean? Essentially, what you want to do is create a formula where you are going to take your total expenses per month and multiply that by 3. Why are we doing this? Well, it's important that you want to create some padding, because of course your expenses are variable. Some months it's going to be less, some months it's going to be more. So by multiplying that by 1.3, you are just leaving that bit of padding on above what you've calculated as your expenses to make sure that you cover for the months that you have additional expenses. So this is quite important. So this is the amount. So after you've calculated all your business expenses, this total to make is the amount that you need to make each month in order to just break even. even. Then the next section is how will you actually make it. Now this section can be a bit tricky for some disciplines compared to others, because if you are in a profession where there are many different codes that you can use for many different assessment treatment types, it can get a bit tricky. Whereas if you are in a profession where there are only a limited amount of codes, and generally, or it's time-based, or your codes or billing is time-based, it will be a bit easier. So for speech therapy, for example, they tend to use the same codes multiple times because their interventions do tend to be time-based. The same with psychology. They might charge for a 1 hour session the same amount. So it would be easy for them to say, okay, well, if I charge 750 for an individual's 1 hour session, then I can calculate roughly how many sessions I would expect to have over a year period. Whereas if you are a physio or an occupational therapist, where you can't actually have set amounts that you charge for treatment or for assessment, because it's going to depend on the individual patient and their specific needs. So it's difficult to kind of guess, okay, I'm always going to charge a 311 code or uh, a 311 code, because every patient is not always going to need the individual 30-minute session. Some patients are going to need a 1 hour session, some are going to need group therapy, some are going to need just a 15-minute session, some are going to need a lot more consultation. So it's very difficult to say. You can't just say treatment and say this is how much it's going to cost. And that's going to be the case for many other disciplines as well. So there's two ways that you can do this section. You can either list out all of the different billing codes that you would generally charge. So obviously, if you're not a hand therapist, you're not going to use codes for splinting and things like that. So, but there might be codes that you will always use, like the 108 code for consulting. I'm now speaking from an OT's point of view because I'm an OT, but whatever the codes are that you might potentially use a lot, you can list here. But that gets very complicated because codes are usually grouped together to form a single treatment, and it's going to be very difficult for you to think, well, how many times are you going to use that code in a year? Now, here's the other thing. The reason why we are looking at how many you're going to sell per year is because you need to factor in what is your maximum capacity. And this is one step that a lot of health professionals or private practice owners are not doing when they are calculating how to set their rates. You're not looking at, well, how much time do I actually have in the day? And what does that mean in terms of what is my maximum capacity for the maximum amount of 30-minute or 1 hour sessions that I can potentially have? Okay, so what you are calculating here is what the revenue you are going to earn at your maximum capacity, right? So you need to think about your unique situation, and this is where your vision for your practice and what kind of practice it is that you want to have is going to be really important. So for example, if you are a mom and you would like to be able to fetch kids and be home in the afternoon, you need to then calculate, well, what does that mean for you in terms of how much hours you actually have to be able to be in your practice seeing patients. So let's say, for example, if you only have 3 hours in the morning, and then you go and fetch your kids and take them home, and then you have 3 hours in the afternoon, and then you go home so that you can be home with them in the late afternoon. That means that you only have 6 hours per day. And let's say you only have your practice open from Monday to Friday, and you are not open on a Saturday. So that essentially means that you have 6 hours every day to see patients, and that 6 hours times 5 means that it's a 30-hour work week. And of course, that doesn't mean that it means that you have 6 hours of therapy time, because you need to account for the time it takes between patients. If you need to set up the environment, that takes time, writing notes. all of those things. So what you want to do is really calculate, okay, so based on those 6 hours, let's say if you are a um, pediatric therapist, for example, and you generally know for the age group and the type of clients that you see that you won't have sessions for longer than 30 to 45 minutes. And then you need to add in a padding of, let's say, 5 to 10 minutes on either side for patients to arrive, small talk, get them started. And then, so that's an hour session. And you have maximum of 6 1 hours, which means you can see a maximum of 6 patients. But let's say you can only see a maximum of 5 patients because you need to take into account the padding and the time wastages that happens around with all the other activities that you need to do in your practice. So that's how you're going to calculate, well, based on that, how many patients can I see per week and how many patients can I see per month. And once you know how many patients you can see per month, you will have a better idea of how many patients you can see in a full year. Now, I will say when you are calculating your number per year, you are not going to take your monthly amount times 12. What you want to do is multiply it by 10. And the reason for that is that you also want to take into account that you are going to have sometimes off, so you need to take into account when you're going to be on leave. Even if it means that you're going to have cover through using a locum, you still want to just multiply it by 10 so that you have a more realistic view of how many patients you can see at capacity. So once you've calculated that, you need to think about, okay, well, if in your practice you tend to have assessment first and then intervention, how many new patients do you think you might be able to have, or how many patients will require assessment while others are requiring treatment? How many times per week is each patient coming in? And that's how you're going to calculate, well, okay, let's say I have 2 new patients per month. I can have 2 new patients per month. Maybe only one has a comprehensive assessment and the other one just has an assessment for a specific dysfunction like gross motor, visual, perceptual skills. And so that's how you're going to calculate. Then what you're going to do is you're going to look at the billing codes and you are going to cluster them into what you typically would tend to bill for assessment or or intervention or and so on. Now, this is not to say that you're creating recipes or formulas because that's actually ethically not allowed. You need to actually formulate a bespoke treatment plan or assessment for your individual client and bill accordingly. But as I said, this is just a planning tool. So it's just to give a rough idea because generally you're going to tend to use similar codes together. So let's say with group therapy, and so when you're making a decision about how you set your rates, what I would advise you to do in this worksheet is to initially set the rate at the medical aid rate just to get an idea of what the medical aid rates charge. And then you're going to look at whether you need to adjust your pricing based on your practice expenses or whether you can keep it the same. So let's say these are all dummy amounts that I've kind of put together just to give you a rough idea. So I've worked out group therapy rate if you bill what is normally billed for group therapy, and based on that you can have a maximum of 12 participants in a group working towards the same aims. And let's say they come only once a week for a whole month, and you have maybe three or you have one group from beginning to end for each quarter of the year. So that's how I calculated. Okay, so it's 12 participants in the group multiplied by the per patient rate by the discovery rates. So what I've worked out is the 2718 is one session of if you can have a maximum of 12 people per group, one session at capacity based on the medic discovery health rates is 2718. And then how I worked out how many sold per year is that if I think, okay, let's say the group meets once a month, once a week, that's 4 times per month, and I'm multiplying that by 10 to get the annual amount, which is 40. So there will be 40 sessions of 12 people per year. And then you want to create a formula that then calculates that for you by saying your price times the sold number sold per year. Then for assessments, what I've done is kind of looked at, okay, well, what is the rate for assessments? What are the rate for comprehensive assessments, and so on and so forth. And then calculated, okay, well, how many do I think I will see per month, per week, or per month? And then calculate, well, how many do I think, and then multiply that monthly amount by 10. And then also list, then I've also, then if you have, for example, with an individual treatment and you know that you always use an observation code with your treatment, you put that in there and you calculate, okay, on average, this is the amount that you're going to charge for most clients. And as again, I want to reiterate, it's not to say that you're going to say that you're going to charge, that's going to be your flat rate. This is just to average out roughly, this is how much you're going to charge. Then you're going to calculate, okay, well, how many patients can I see at maximum for a 30 minute to 45-minute session? How many patients can I see at maximum per day, and therefore per week, and therefore per month? And once you have that monthly amount, again, you're going to multiply that by 10 to get your yearly amount. And then you also want to consider other revenue sources, like maybe you run a workshop once a term at a local school and you charge $250 per delegate and you get, let's say, 10 people at a time. So that means for one workshop, it will be 2,500. And if you run one a term, then that will be 4 per year. Now, this is basically just to give you a rough idea of how you're going to go about it. Of course, if you're a psychologist and all you charge is an individual session, a flat rate of 800 Rand, and you then do the same exercise of work out, well, at your maximum capacity, how many patients will you see per month, times by 10, and that will give you that amount. And then each amount here is then going to take your price multiplied by the number of sold per year. And then you're going to create a formula that calculates what all of these amounts then add up to give you your total yearly revenue. And then, of course, you're going to say the total yearly revenue divided by 12. Okay, so even though you calculated how many you sell per year based on a 10-month calendar, you're going to then split your revenue into 12 because, of course, the year is only 12 months. Okay, so what you want to do is you're going to take the amount that you've calculated, what you need to make each month, 49,658.70 in this example, and you're going to draw that value from that cell into the amount that is needed, and then your monthly revenue, which you calculated here as your average monthly revenue breakdown, will be here. And then you're going to say the monthly revenue minus the amount needed to work out the difference. So based on this example of the expenses that I've listed here and the revenue that I expect to earn at capacity, there is a 491.28 cents difference, which means that my practice will be making a loss. Okay, so this is important information to know. And this is going to then help make decisions in my business about my rates and also about my expenses and also about decisions I need to make with regards to expansion and growing and hiring and all of that. So this is how we're going to do it. Notice that there's a difference and we need to now correct that. So there are a number of things we can do. The first thing you can do is you can go back to your expenses and look at how can you actually lower your expenses. So are you willing to lower your salary? Are you willing to maybe find a different premises where the rent is less? Maybe you want to cut down on your consumables. Maybe you want to find a different contract. Maybe you want to change your hosting. So you need to think about what are you actually willing to cut in your expenses. But don't just cut expenses that are essential, like, for example, say, okay, you're not going to pay the billing administrator anymore, or you're not going to use the billing software anymore, if these are expenses that are actually making the running of your practice more efficient. So if you think, for example, if you're paying a billing administrator or you're paying for a software, and it's actually ensuring that you are actually getting paid, or that the medical aids are actually paying you, or that a patient is paying you because you have somebody following that up, that is revenue that is coming into your practice. So does it make sense to cut that expense if it's going to mean that actually bringing money into your practice is then affected? But you do want to look, because obviously this is not all the expenses you can possibly get. So you do want to look at whether you can cut your expenses or not. The next thing you can do is, of course, to look at how will you make it. So this is where setting your rates based on the numbers rather than the feelings that you have about what rates you need to charge is really important. Now, one important thing to remember is that even though we group the codes to get an average of what we would charge for certain things like assessments and individual treatment and so on and so forth, you can't actually if you decide, well, based on the medical aid rates, I'm not going to cover my expenses, so I'm not going to charge medical aid rates, I'm going to charge private rates. So but you can't then, because you decide that, now just add random numbers. So I can't now just based on this 2718 now decide, okay, well, now I'm going to charge 3,000 Rand for group therapy, and work backwards what that means for my individual clients. Or I can't just decide, okay, well, for let's say this individual treatment, which consists of 3 different codes, I'm now going to charge 500 Rand for it, because you need to, when you bill, you're not going to bill for individual treatment, you're going to bill for each code individually. And those codes and the billing and the amount that it's charged for are weighted a certain way. So an observation is weighted something and costs, like, let's say 85 Rand, compared to a consult, which costs whatever the amount is. The weighting has been set a certain way. So you can't now go and increase the one code by 50 Rand and the other code by 100 Rand, because then it's not going to adhere to the weighting standards that has been set. So what you want to do is actually work out what is the percentage increase that you need to make in your pricing in order to break even or cover your expenses, right? And then what you're going to do is take that percentage and apply that to each of the codes, so that all of the codes are increased incrementally at the correct ratio for the weighting with each other. Okay, so what you can do is, there's 2 ways. You can either say, okay, I'm going to put my prices up 5%, or you can work out, well, okay, the difference that I'm making is 491.28 divided by, and divide that by the monthly revenue that you are making, 49,167.42. 42, and that percent is 0.9%. So let's say, okay, so 0.9% is the percentage that you need to increase your prices by in order to have the difference be naught. So let's say you're going to increase your prices by 2%. So if you then apply that to this, so you can now apply that to all the pricing here. But what's going to happen is, in your individual, because if all your individual codes are increased by 2%, it means that your total price is also going to increase by 2%. So if you're going to say 2718 plus 2%, and that price now becomes 2772.36. Okay, I'm going to do this for each one. So I'm just going to pause the video and adjust all the numbers, and then we're going to see what the difference is. Okay, so I've adjusted all the numbers. So just to illustrate my point about how the individual codes will, if you assign the percent increase to the individual codes, it will end up when you group them together, changing the the code altogether. So if you look at an example of the workshops, if you want to charge 250 Rand per delegate, and 10 delegates would have given you 2,500 Rand. If you take 250 Rand plus 2%, that gives you 255 Rand, which times by 10 is 2,550. So that's why I'm saying what you want to do is you're not going to just increase your prices, random amounts, 50 Rand here, 100 Rand there, what you think sounds or looks good. You actually want to choose, you actually want to understand by what percentage do you actually need to increase your price. So as you can see now, had I only increased it by 0.9%, then this difference would have been 0, because that was what the difference, the loss that I was making was needed a 0.9%. But because I've increased the prices by 2%, I now see I have a positive difference. Now, normally this would be, oh, well, that's not a lot of profit. But remember, what we did was we actually accounted for profit in the expenses section. So if you didn't account for profit in this expenses section, so let's say we took that out, what that would mean is that in the difference section, you now would make a difference of 1,791, which means you do now actually have a profit of over 1,000 Rand. But I'm going to put the profit back in here. So let's say we put the profit back in here. This is your monthly profit. And the difference goes back to 491.84. So actually if everything was exactly as you are projecting in this revenue planner, then your difference, your profit would actually be more than 1,000 Rand, because you would have this additional amount. So that is how you can actually adjust your rates or determine what your rates need to be, whether you can afford to charge medical aid rates or whether you need to actually charge private rates, rather than saying, well, I don't want my patients to be out of pocket, so I'm just going to charge medical aid rates, and then you actually find that you're making a loss. So another way that you can also make decisions, so you can either, so like I said, you can either cut down on your expenses by reducing your salary or cutting down on certain services that you pay for, or you can increase your prices and choosing your percentage of increase based on how much of difference you want to have. Or another way, a third way that you can actually influence this number over here, the difference between your revenue and expenses, is to actually look at your capacity. So you could say to yourself, well, okay, if I open my practice on a Saturday as well, that gives me an additional 3 visits that I can have per week. So 3 Saturdays per month is like, that's 4 Saturdays, or you want 4 Saturdays per month, and again times 10, which gives you an additional 40. So let's say you can now increase your individual treatments to 640. Okay, and then that again will increase the difference over there, and you could maybe and then, so that is another decision you can make. And then another way that this worksheet can actually help you make data-driven decisions in your business is, let's say now you do have this difference, you have this month to play with. If you think to yourself, well, okay, I would like to make more revenue in my business, and one way of doing that is have more capacity. And if you are a practice who are in the fortunate position where you have a waiting list, or you are actually operating at capacity, now you are considering employing another therapist. This worksheet can help you make a decision around that without just jumping in blind. So you can think to yourself, okay, if I bring on a part-time therapist and employ that person, and let's say I'm going to pay that person 10,000 Rand a month, And when you, let's say part-time employee, part-time therapist, right? And you're going to pay this person, and you then calculate, okay, how much can I afford to pay this person? Now, when you are calculating salaries, you need to bear in mind the ethical, the employment ethics that you are need to adhere to. So this is not a locum. This is somebody who is employed in your business. Even if they are just once a week, they are still an employed person in your business, which means they are entitled to all the basic conditions of employment, which is pay as you earn. And you need to then think about, well, how much am I able to pay them as my total cost of employment? So not how much I'm actually going to pay into the bank account, but how much is the total cost of employment that am willing to offer. So if you're saying to yourself, okay, well, I'm willing to pay this person 10,000 Rand a month, and that includes, this is before deductions. So you need to be clear on that, so that when you are actually looking to employ somebody, that when you tell them the salary is 10,000 Rand, they need to understand that it's 10,000 Rand before deductions, that you are actually going to deduct UIF and pay as you earn and so on and so forth. Okay, but the point is, when you think about, okay, what is the total cost of employment that you are wanting to employ somebody at, and you've put in the 10,000 Rand, and you now look at, obviously now you're going to have a loss, right? But that is only because it's a loss based on the capacity of you being the only person in your practice. But if you have a part-time employee, and let's say this particular person is part-time, so instead of 30 hours a week, they're working 15 hours a week. You could say then you could then increase your assessments by another, let's say another 40. So instead of 80 here, you'd have 20, and maybe your individual treatments will increase by another 20. So that's 660. And let's say this particular person does an additional 40 home programs per year, that's 100. And maybe this person is responsible for the home visit, so maybe there's an additional 10 years, so that's 30. And then you can see, based on the capacity you now have, well, there's still a difference of 5,000. And then you can think to yourself, well, is it then worth it to employ somebody? Maybe not. Maybe I need, or do I need to think maybe bring them in, maybe I need to offer a lower salary and see if I can find somebody who is willing at a lower salary. Or maybe I need to play around with how many hours they can come into the practice. Maybe they only need to come in 1 day a week, but they can still make significant increases in how many patients they can see. They can take a weight off my plate. Or maybe you think to yourself, well, okay, I'd like to have some more time to myself, so I'm willing to take a lower salary. Let's say you're now willing to take 20,000 Rand because you want to have more days off, and this person will be in the practice on days when you're not in the practice. Then you can look, okay, well, it's worth that difference because I now can take every Friday off, and this person is seeing patients in my practice. So that this worksheet will also help you make decisions around whether it is cost effective or worth it for you to actually employ a part-time therapist, or bring on other staff members, a receptionist, or whatever the case may be. And then the last and final thing that you can actually make decisions about in order to change this difference amount here is to actually look at your revenue sources. So let's say you didn't have workshops, right? And this difference is now only 280 Rand, but let's say it was a negative difference, and you want to now close that gap. Instead of increasing your prices or cutting your expenses, let's say you are at capacity or cutting your expenses, another thing that you strategy you can use in order to close that gap in the difference is to look at alternate revenue streams. So whether that means adding a new layer to your services that you provide, of course, within the scope of your practice, or offering some fringe services such as your workshops. And so now, based on this, you decide, okay, well, you're going to run um, uh, one workshop per term, and you're going to market it at 250 Rand per delegate, and you can take maximum, and you expect that maybe not more than 10 people will come, or you can only accommodate 10 people at a time. So that's 2,500 Rand per workshop. And because you're running 4 workshops a year, it's 4 workshops per year. Then you will see, okay, well, now the difference increases. So that is the other. So if we recap, what are the decisions you can make? You can either decrease, you can either look at cutting your expenses, or you can look at increasing your rates by coming up by deciding on a percentage increase above the medical aid rates, which then gets applied to each of the billing codes that you bill the client on the invoice, remaining consistent with the ratios that have been set. Or you can increase your capacity by working more hours, or opening your practice for additional hours. Or you can look at the viability of bringing in additional staff so that you can increase the capacity for revenue. And this obviously only makes sense if you actually are already at capacity and have a waiting list to be able to give that additional staff member work to do. Or you can look at alternate revenue streams, or increase or adding streams to your revenue so that you have additional ways that you can earn, but you also need to take into account your capacity. So of course, if it is something like a workshop or a course that you put up on a CPD platform like Calabash or Impact Learning, which is more of a passive revenue stream, then it's not going to really be affected by how much capacity you have. That would ideally be a way of increasing your revenue.
So as you can see, once you have mapped all this out, you will gain so much clarity around your rates and to take the emotion out of the decision. So I'm just really excited for you to be able to share this with you. And again, you can feel free to recreate the spreadsheet for yourself and for your private practice. But if you want to just download this exact template so that you can hit the ground running, I have made the ready to use blank templates as well as this demo sheet that I just worked on now available for you for just 90 Rand. And you can find the link to purchase it in the description box below. But again, if you want to recreate this yourself for free, that's completely fine too. The template is just a nice, easy way for you to download and use immediately. So I hope you found this helpful. I just know I found it really hard to know how to charge for my services. So by being able to plan it out based on numbers and not feelings was just really, really helpful. Now, I do also have a free on-demand class on how to create a profitable private practice without the marketing overwhelm. So if you'd like to watch that class, you will find the link for that in the description box below as well. Or you can just go to www.privatepracticegrowthclub.com/free.